Okay, so we are about a few minutes out from starting, and Nowcast SA will be streaming our presentation live. So at this time, we're going to get some last-minute coffee and some refreshments and some water before we get started. We do have refreshments on both sides of the room. Also, too, please remember to sign in for the CEUs. There are sign-in sheets on the table that have boxes on each side. So if you can please fill out a box and have that ready. So we'll be starting here in a few minutes, okay? Thank you.
You'll be on the wall. I want to give you look up to you.
Monday?
I want to give you look up to you.
Okay, man. I was when you guys had your no, porque si me le dieron la puerta, we have to do one.
For what?
Right, that's what I'm asking. She sent it, we have to write down what kids to work on.
Okay, good morning, everyone. Can all please have a seat? We'll get started here shortly. So good morning, ladies and gentlemen. My name is Gina Wattis, and I am the PRC Director with the San Antonio Council on Alcohol and Drug Abuse. It's a pleasure having you here today with us, and welcome to the first ever Prevention Resource Center Region 8 Community Stakeholder Meeting. We hope you enjoyed the presentation and leave feeling enriched and empowered by what you learned today. So at this time, I would like to take the time to go over some general housekeeping. Please silence your cell phones and feel free to use the lobby to take any phone calls. The restrooms are located just outside the door and directly in the hallway next to the water fountain. Please be sure to sign in using the white sheet with the 4 boxes on it. CEUs will be given at the end of the presentation. We will add your email to the list if you aren't already receiving our emails. Please write your questions on the index cards on the desk. So on each desk there are white index cards. We will have a question and answer part to this presentation. So as you start to write down your questions, if you can please pass those to the right, we'll have our interns come by and pick those up and address those at the end of the presentation. So for all you social media people out there, we are using the hashtag Texas Data to track our conversation. So when you post and tweet or snap, be sure to use hashtag Texas Data. We would like to thank our friends from Nowcast SA for providing live webcasts for today's presentations. So hello to all our online friends and other PRCs that are watching. We're glad to have you here with us today. A copy of today's presentation will be uploaded to Sakata's YouTube page and available to view at any time. And thank you to our interns with all their help today, and to all our Sakata family for all your support. I know we've been running around very, very crazy these past couple of days, but we couldn't have done this without you all. Okay, so before we start our meeting, I would like to invite one of the most passionate people I know in this field to give our welcome message. We've been working together for almost 10 years, and she's just as motivating since the day she first started here at Sakata. So ladies and gentlemen, I'd like to welcome Sakata Executive Director, Abigail Moore.
Because 4'10", if I stand back there, all you see is a floating head. So we don't want to do that, right? Again, welcome to our agency. We're really, really excited to share some of this information with everyone, because this information is not about us. It's about providing it back to our community, empowering our community with the data that tells the picture of what our needs are, what our gaps are, what the resources are available out there, and how can we better leverage and work together, and then see improvement in our community. So, a show of hands, I'd like to know who's here. So, if you directly work with individuals struggling with substance abuse, please stand up. Directly work with individuals struggling with substance abuse related issues. Directly. I mean, not like you, but your agency. If your agency does, not just you, the people you represent. So that's about half the group. Now, no, stay standing, please, I'm sorry, stay standing. So, if you work with either children of substance abusers, parents of substance abusers, family members, or you indirectly work, or your agency works with people that struggle with substance abuse or the consequences of, please stand up.
Yeah, anywhere you like.
So these are the prevention folks, the community social workers that work with, okay, so that is about 90% of the group, okay? So stay standing up, and real quickly, some of our friends here that are, what agency do you work with? Housing and community. So sometimes people needing housing and
I work with a senior and adult disabled.
okay. Over there? Teen pregnancy. So sometimes kiddos that are drinking tend to have unplanned sex and end up pregnant. Would you say? I think you need to stand up. I don't mean to be bossy or anything. And look, I just saw some of y'all standing up. See, that's cheeky. Okay, so over here, who do you work with?
I'm also a motivation speaker for the youth, and also a home health provider. But I do a little bit of everything. As of right now, I'm not working at one school. So that's what I'm at. Thank you for having me here.
Thank you.
I work with the Texas Health Steps and START programs. We work with low-income families that receive Medicaid benefits, talk to them about the importance of preventive checkup for children, and help them find out benefits.
So do you ever see substance abuse related issues with those families? Do you ever see substance abuse related issues in those families?
We can come across it.
Yeah, you should have been
Okay.
Okay. So I think you were kind of, you see where I'm going, right? I think there's I'm going to put a point on you. Well, what do you do, sir?
SAP device, and we deal with, when we run into it, it's the MIPs, alcohol.
Really? You shut up down standing up.
I'm the consequence.
So thank you. Everyone, please have a seat. Do you see how we're all interrelated and connected? None of us really go through our day somehow, some way that we're not impacted either by someone's use or hoping that someone doesn't use. Think about it. If our Bus drivers that take our grandchildren to school are taking prescription drugs and are abusing prescription drugs, even if they are prescribed to them. Does that become a safety problem on our streets, with our children, with our community? So again, the connection is huge. And you being here just demonstrates how it really impacts all of us and how we are all part of that solution. So I want to do, anybody familiar with Stephen Covey, 7 Habits of Highly Effective People? One of my favorite books in the whole world. We can apply those kind of principles to anything in life. So Stephen Covey from up there, thank you for the book, and I'm going to borrow a little bit of your stuff. So, 7 habits of highly effective communities. Let's go there. Habit number 1. The habit is being proactive. Guess what? Everyone here is proactive because you want to know what the data says. You want to know how it is going to impact your community, whether it's the seniors, whether it's the families in need of services whether it's what was it, Medicaid or Medicare? Yes. So we're wanting to know what the data says. So being proactive, habit number 1. We've all can check that off as a community of being effective together. Habit number 2, begin with the end in mind. So what is the end in mind that we want in our community? Anybody? A healthy community, right? Drug-free, thriving, safe, young people being successful, graduating from college, all of those things. Begin with the end in mind. So our end is a well, healthy, thriving community, right? So we can all check that off. We're here looking at, we're all wanting to be part of that. Habit number 3, put first things first. Well, what does our community look like? Addressing today, the regional needs assessment will help us look at putting first things first. If we don't know what the data says, if we don't know what the trends are, if we don't know what the resources or the gaps are, how can we get to the end? Right? The end in mind, which is that healthy community, thriving families and children. So we can all check that off. We're all here together as a group, community, wanting to be a highly effective community. Habit number 4, think win-win. We don't do things like, well, that's not what I do. I'm going to stay in this little silo. No, we think win-win, because if we all come together and we think win-win, we get that community of highly effective people, community where we're all thriving, we're all healthy, our young people are being successful, our seniors are enjoying being, at that time of their life. So again, think win-win. We can all check that off together here in this group. Habit number 5, seek first to understand, then to be understood. So today, you're kind of going to sit back, and you're going to listen, get some information, get the data, see what it says, help us identify what's missing. You're very important. And so your feedback on saying, wow, well maybe, did you think about these trends, or could we add maybe this to it next year? How can we strengthen it together? This is about, this resource is for us. So seek first to understand and then to be understood is first listening, is that communication. We're all here to learn and to identify what these gaps are, and then we're going to try to share or get involved, advocate, maybe join the epidemiology, I can't ever say that word, work group. Thank you so much. It's the Latina in me. But anyway, we need those people that know the numbers, that know the data, that can help us tell the story. And then habit number 6, synergy. To synergize as a team, it's about working together. And again, if addiction impacts the family, is it going to impact the kid's classroom at that school? Is it going to impact that whole little neighborhood? Is it going to impact that church? So synergy, the opposite way that we take it positively, will help us be effective in that way as a community. And then the last one, sharpening the saw. How can we sharpen our saw as a community, as stakeholders? Hello, here we are. Learning to identify, learning to look at the data, learning to use it better, and implement it in our community. So as I wrap up, one last thing, I love to make people get involved, work with all, us have fun, and since you're gonna be sitting a while, I'm gonna make you stand up. All I need is about 2 minutes of your time. Well, not yet, not yet, not yet. So, I am going to ask from this row, you're looking at me, from this row, this way, to stand up. That is about 60% of you. No, this row. Stand up with me, this row. Now, there's few of y'all sitting down. You're about 40% sitting down. 60% of secondary school children in Bexar County reported having consumed alcohol. Look at your peers in secondary school. That's a lot. Okay? Now, this group can sit down. Up to here can sit down. You stand up right there. Stay standing up, stay standing up, stay standing up. Everybody, standing up. So about 25% of these kids, again, reported using in the last 30 days. These are kiddos in our schools here in Bexar County, Texas School Survey. These kiddos have consumed alcohol in the last 30 days. Big deal, isn't it? Thank you. Have a seat. Now, come over here. I am going to ask from this row, this way, to stand up. Bexar County School Survey. These young people in school here in Bexar County were asked, have you received prevention services in your school, in your community, in your churches? And then they were given the definition of what prevention services were. All of y'all did not get prevention services. Only those few standing up did. We got a lot of work to do. And that's why I am so excited, thank you, you can sit down, that we are here to do that together. This is work that will strengthen our community, that will make San Antonio, Bexar County, and our region stronger. So again, thank you. We appreciate you being here, and we'll open it up for questions. Like Gina said, there's little note cards. Write them down because we want to make sure that we articulate them correctly and share them with our friends that are online. And I'm sorry that they didn't get to stand up. I wish I could have somehow made them stand up, but I couldn't figure out how many were on. Again, thank you and welcome.
Told you she was passionate. All right, thank you, Miss Abigail. So now I'm going to take this opportunity to introduce the PRC region. So these ladies have worked very hard to the past months, attending meetings, gathering data, shaking hands, going to communities, meeting people, crunching numbers, and driving many miles to help gather this information. So I'd like to introduce Teresa Stewart, who is our community liaison, Betsy Jones, who is a community liaison and is now our tobacco prevention specialist. We have Hortensia Carmona, who is our regional evaluator. And we have our newest member, Alexis Lawrence, who is our community liaison. So again, this is our PRC Region 18. Okay, so now the interactive part. So each person should have a turning point clicker on your table. So we are going to use this to answer some questions I'm about to show you. So Turning Point is one of our favorite tools because it's an interactive type of audience survey. Not only does it allow audiences to interact, but it also captures the data. So all the answers that we're collecting today, we're going to be able to save those and use those for later. All right, so now that I told you about Turning Point, let's go ahead and give it a try. Okay, so the poll is now open. What is your favorite color? A is red, B is orange, C is green, D is blue, and E is yellow. Okay, we're at 67 responses. It looks about to be how many people are in this room. Poll is closed, and it looks like the favorite color of today is blue. So that's how Turning Point works. This is not the colors training, I promise. Okay, so let's go on to our next question. Oops, I'm sorry, I went too far. Let's try this again. Okay, so in dealing with the public, what best describes your role? Would you say A, substance abuse prevention professional, B, substance abuse treatment professional, C, educator, D, faith-based, E, law enforcement, F, healthcare worker, G, mental health care, and H for other. Okay, our poll is closed, and it looks like a majority, we have a lot of prevention professionals in the room as well as a lot of other. Can I get whoever, some of you who said other, to stand up and let me know who you're with? You're like, no. Okay.
With the University Health Systems Foundation.
The University Health Systems Foundation, thank you.
And Child Protective Services.
And Child Protective Services, thank you for being here today. Okay, so that gives us a good idea of who's in the room. Moving on to the next question. How much of a concern is there in your community for problems caused by alcohol, tobacco, and other drugs? Is there a great concern, some concern, or no concern at all? So thinking about the communities that you work with. Okay, and it looks at, everyone has answered, and 71% of you say that there is a great concern. So there is obviously a need that is stated there. Okay, moving on to the next question. How would you rate your knowledge of alcohol, tobacco, and other drugs and mental health issues in your community? Would you say there's low awareness, B for some awareness, or C for high awareness? How would you rate the knowledge of your community? Oh, I'm sorry, I didn't open the poll. Here we go. And it's okay if you push the button more than once, it'll only record your answer once. Okay. And it looks as if 51% of you had said that there was a high awareness. 31% said low awareness, and 18% had said, oh, I'm sorry, I had that wrong. 18% is a high awareness, and 51% said there's some awareness. So maybe there's some issues going on, but maybe not fully knowing what's going on. That's where the data helps us. Okay. How would you rate knowledge of alcohol, tobacco, and other drugs and mental health issues in your community? Still some votes coming in. Okay, so I'm going to close the poll. Okay. And it looks as, again, 51% had reported some awareness, 35% said high awareness, and 14% said low awareness. So in your community, what place would a person first turn to for help if they had substance abuse or mental health problems? So would they be calling A, crisis hotline, B, a doctor, C, faith-based person or group, D, law enforcement, E, family member, F, mental health worker, G, counselor, H, 12-step, and I for other? closed the poll, and it looks like 50% had said mental health worker, 10% for crisis hotline, 3% for doctor, 12% law enforcement, 4% family member, 4% counselor, 4% 12-step, 1% 12-step, and 10% other. So interesting.
50%. It's hard to read.
It is hard to read, I apologize. Actually, the 50% is on the mental health worker. Is it?
Yes. See how the.
Oh, okay. It is family member, I apologize, thank you. So family member. So we have to make sure those family members know what resources to turn to. Okay. Let's see, I'll go backwards. Okay, we did this one? Okay. So which substance poses the biggest problem in your community? Okay, closing the poll, I'm seeing that 44% of you said alcohol. Okay, let's see, moving to the next question. There are enough prevention programs in my community. So for example, DARE, after-school programs, parent support programs, drug and alcohol prevention programs for youth and adults. So I'm going to close the poll, and it looks to see that a majority of us either disagree or strongly disagree. What about, let's see, there are enough mental health and substance abuse treatment resources in my community. For example, counseling, 12-step programs, treatment centers. And I'm going to close the poll, and it looks at 52%. So over half of this room strongly disagree that there are not enough treatment services here in our community. Okay. So does your community utilize these programs? So for example, DARE, after-school programs, parent support programs, drug and alcohol prevention programs for youth and adults. Does your community utilize them? Looks like all the votes are in. And 39% of you voted no, and 8% of you voted not sure. So there's some data that we are needing, as if our community centers are being utilized at all, or your community programs. Interesting. Okay, going on to the next one. How knowledgeable do you feel members of the community are regarding alcohol, tobacco, and other drugs, and mental health issues, such as signs and symptoms, drug trends, the health risk? I'm going to close the poll. We have 83% of you voted that your community has some knowledge that's out there. All right, so how knowledgeable do you feel about alcohol, tobacco, other drugs, and mental health issues? Okay. So 39% of you voted that you know you're knowledgeable, and 42% said that you're very knowledgeable. So we have the professionals in the house. All right. Okay, so what are some top concerns for you and other leaders in the community? So I apologize for the small print. I couldn't fit them all on here, but out of these categories up here, which of these are the top concerns for you and other leaders in your community? The numbers keep fluctuating. It's interesting. Okay, the poll is now closed. I believe that says 34% of you have voted mental health issues are as a top concern for you and community leaders here in the community. So, okay. All right, so did y'all like that activity? All right, it was pretty good. Got to see some numbers. Anything that jumped out at you? No? Okay. So, this is the kind of information that we use to help us paint a picture. It's good qualitative data that we can take, especially having professionals like you in the room. This helps to give us a good perspective of our audience and of our community. So I'm now going to talk about the Prevention Resource Centers. So some of you might remember the Prevention Resource Centers as being literature clearinghouses. We used to do Red Ribbon, we used to give out materials and come out and do presentations. Well, in 2014, the scope of work changed for the Prevention Resource Centers, and we are now data repositories, data collectors. We are to create a regional needs assessment, which is what we're talking about today, to try and give a picture of what's going on out in the 28 counties. And I don't know about you, but I know that sometimes we get a little frustrated when we're out there trying to get some information and there's none to be found. If I'm going to do a presentation for Maverick County or for LaSalle County and I have no numbers to go by, then I try and use Texas numbers or state numbers. But what I really need is county numbers or county information. So the purpose of this needs assessment, again, is to try and paint a picture, or to try and give an idea of what's going on in those counties. And so, kind of went on a little thing there, but there's 11 of us in Texas, 11 Prevention Resource Centers, and one for each Health and Human Service regions. So here are the PRCs for the state, with the respective city that they're in. So we are Region 8, the 28 counties of South Central Texas that are here in San Antonio. So the PRC team roles. So we do have a statewide evaluator, and his name is Albert Young with DSHS. And what Albert does is that he helps to guide the 11 other evaluators in creating assessment. So they talk about the indicators, they talk about which kind of data sources they're going to use, they talk about the template. So they work together annually to produce a regional needs assessment. So when you read ours, and let's say you read the Region 8s and you read Region 1s, even though they're in Lubbock, they're going to have the same state material. So the data that the evaluators choose, we try to have the same language. We want to measure apples to apples. And so you'll see a lot of the same state information in all the PRC regional needs assessment. However, they will start to differ once we start to get into the regional part. So Hortensia Carmona is our regional evaluator, and she's our numbers cruncher. So when we go out into the communities and we bring back information, we give the data to her, and she starts to crunch those numbers and starts to paint that picture that we're looking for. So our community liaisons are the go-getters. So these individuals are out going into communities, into meetings, building the trust of those in the outer counties, Some of you who work with the 28 county regions know that you have to get a community's trust before we can start working with that program. We got to get buy-in from the community so that we know that if they're giving data to us, that data is going to be protected and it's going to be used for good. So this is what the community liaisons do. And the tobacco prevention specialist has a big job. They go out and they visit 1,800, that's 1800, tobacco retailers here in our region. So they make sure that they're complying with the state laws. They make sure that they're not selling to minors and the consequences that come with that. And Betsy will talk a little bit more about that when we get to that portion. So that's what the PRC does. So now, talking about the purpose. So the regional needs assessment is a document developed with state, regional, and local data to provide the community at large with a comprehensive view of information about trends, outcomes, and consequences associated with drug use. So basically, the regional needs assessment is a toolbox full of valuable data tools ready to be utilized to build something great. And if we leave unutilized, it will benefit no one. So as we're talking about data sources and data trends, if there's something that that you think may be of a resource or that may be available, or maybe there's data that you need, we want you to request that from us or to let us know. And so here we provide you all with a prevention resource folder that has our information in there, and there is a data request form. So we're encouraging people to use that form to request any type of data. And a lot of the data you're going to be hearing about today is regional, but we do have county specific. So again, use that data form to not only request the data, but also to, if you want to get a request of the regional needs assessment, which will be ready on July 30th. All right, so why is data collection important? Well, let me give you an example. So let's say there was a fish that was sick, and our first instinct would be to check the fish to see if something's wrong. But then another fish gets sick, and then another fish, and then another fish. So fish are continuing to get sick. So we have to think that maybe it's not the fish that are getting sick, but rather what's making them sick. And so data helps to give a clue to the bigger picture. So now I'd like to introduce our regional evaluator, Artemisia Pomona, to speak more about the methodology behind the regional needs assessment.
Good morning, and thank you everybody for attending. Can y'all hear me? Yes, okay. Today I will be discussing the methodology used for the 2015 Regional AIDS Needs Assessment on Drug Use. But first, I would like to go over the role of the evaluators and the project goals. Regional PRC evaluators are responsible for developing data collection strategies, conducting surveys, and focus groups. We're also analyzing the data, creating reports, and databases for central data repository. The data repository is where we're storing all the data that we collect from our communities and from our associates. We also collaborate with the DSHS, Statewide Prevention Evaluator, in providing the state data for them to collect as well. We work with our community liaisons and prevention specialists to identify potential collaborators and provide data resources. We are responsible for gathering alcohol and drug consumption data and related risks and factors that affect our communities. Our work is tracking substance use patterns and key findings and are disseminated through a variety of methods to include fact sheets, presentations, reports such as the regional needs assessment. And an example of those templates are also included in the folder that you were provided. This work serves to promote and to provide state and local agencies valuable prevention data to access target communities and high-risk populations in the need of prevention and statistical services. As one reads this document, two guiding concepts will appear throughout the RNA. The reader will become familiar with a focus on the youth population, the adolescent ages between the ages of 12 and 17, and an approach from the public health framework, also known as epidemiology. The mission of the Prevention Resource Center 8 is to serve as a central data repository and substance abuse training liaison for the regional community. As a central data repository, the PRC has developed a storage to maintain all sorts of data, not just related to substance abuse, but to all kinds that we can assist you with fighting. The PRC has developed the RNA in hope that it will tell the story of the 28 counties. The data collected and used for the RNA includes the state's 3 main priorities, which are alcohol, marijuana, and prescription drugs. Region 8 focused on secondary data for the 2015 RNA. We hope to focus on primary data for the upcoming 2016 RNA, which is more focus groups, and hopefully it will be more within the communities within our region. Data from the RNA provides national, state, and regional level estimates on the use of tobacco products, alcohol, illicit drugs, to include not medical use of prescription drugs, which is over-the-counter, and other social factors in Region 8. In keeping with post studies, this data continues to provide the drug preventions and the treatments and research within the communities with current relevant information on the status of drug usage. Many government agents and the public at large use this data. For instance, many state health agencies use data to estimate the need for treatment facilities. Other federal, state, and local agencies use the information to support prevention programs and monitor drug control strategies. The purpose of the RNA was to provide relevant substance abuse prevention data in Region 8 and throughout Texas, specifically adolescents, and this regional assessment serves to discover patterns in substance use and monitor changes in trends over time, specifically with the youth. To identify the gaps in data where critical substance abuse information is missing. We also try to determine the differences and disparities throughout the state. We try to identify substance use issues unique to the communities and region within the state. We provide a comprehensive resource. We are providing a comprehensive resource tool for local providers to design, target, relevant data-driven prevention, intervention, and treatment in the state of Texas. The report will include an overview of regional substance abuse information as well as more detailed data on trends and consequences of specific drugs. Upon request, more specific data on any subject can be obtained or stored in our data repository, which means if anybody has any type of data and would like to share it with us, we would be glad to have it with us in case anybody else within the community, agency, local, state are wanting that information as well. Epidemiology is a theoretical framework for which this document evaluates the impact of drug and alcohol use on public at large. As a study of disease when applied to drugs and alcohol, it uses trends. Epidemiology underscores this public health concern as both preventable and treatable. Many states have evaluated drug and alcohol use from an epidemiological perspective for the last several years, and have gained ground in prevention work as a result. By investigating risk factors, protective factors, and consequences of substance abuse, related issues society can address causally rather than merely identifying symptoms. Ongoing surveillance of data and necessities. The standardization of measurements with regard to indicators, which means the methodological process of the state and regional levels. One of the main concerns that we have been noticing when going out to the communities is confidentiality. Both SACADA and PRC 8 are committed to assuring the confidentiality of all data. Our interest is only in the combination of all statisticals collected, not on individual answers or personal information. Full names are never recorded or associated with participants' answers. Confidentiality of the answers provided to the questions are protected under federal law by the Confidential Information Protection and Statistical Efficiency Act of 2002. By law, all responses can only be used for statistical purposes. Regional evaluators and the statewide prevention evaluator chose secondary data sources as the main focus of this document, based on relevance, timeliness, methodological soundness, representativeness, and accuracy. In the needs assessment for Region 8, surveys and other qualitative data will be mentioned to add narrative to each section. Data employed into tables comes from the most recently available data sets reflecting the criteria mentioned. Some of the used data sources, including data collection systems and organizations within numerous reports, included the U.S. Census Bureau, National Vital Statistics System, the Behavioral Risk Factor Surveys, other surveillance programs, World Health Organizations, private organizations, universities, just to name a few. Data, mainly qualitative data, is imperative in epidemiology. Evaluating and documenting frequency, type, and distribution of incidents is key to understanding substance use and abuse, what causes them, who is it affecting, and how to prevent further occurrences. Understanding data allows communities, public officials, and stakeholders to target causes, affected citizens, and gaps in resources. The state and regional evaluators collected data at the county, region, and state levels between September 1st through May 30th of that year for the regional needs assessment. Different work groups were created. For instance, I participated in the strategic plan and data source committee. I helped the state develop the strategic planning for all 11 evaluators along with a couple of the other co-workers. Relevant data elements were determined and reliable sources identified through a collaborative process among the committees, with support by the Southwest Regional Center for Applied Prevention Technologies. Subsequent to understanding the reasons for the target youth demographic and public health approaches, research will be presented with a discussion about other key concepts, such as risk and protective factors, consequences, consumption factors, and contextual indicators. Substance use is not restricted to any age, gender identification, race, ethnicity, cultural experience, or religious affiliation. While the incidence and prevalence rates of substance use among all demographics are concerning, evidence indicates that prevention work done with adolescents has a positive and sustainable community impact according to the Treatment Research Institute. Most concerning are the effects that substance use has on youth. Brain development, the potential for high-risk behaviors, possible injuries, substances include the focus on following factors: age of initiation, early initiation, current use, lifetime use, and consequences. There are some gaps within the research, and they have been identified and will be made available in the RNA. Some of those gaps that have been identified are inaccurate data being presented, contradicting data, overlapping of information, misconceptions, and misinterpretations of data. So not only is data important to be attained, but we have to make sure that we're getting a clear picture. Because right now, it's very hard to say for Region 8 how bad our substance abuse is with our youth if the data is not being presented. Also, another gap that we have noticed is the minimal availability of local data or sharing of information that was also identified. The data we collect serves as a useful tool in data-driven decision-making. Over the past 2 years, the PRC teams have taken the cause of the data initiative into the communities through presentations, work groups, meetings, and media awareness activities to inform decision makers and others about the significance of data. Once published, the analysis in this report will be made available to the public and can be used as a regional tool. We also hope to provide the RNA in Spanish version as well, as we do see a gap in our language barriers with our public. So at this time, I'm going to conclude with the methodology, and I'm going to go ahead and pass it over to Gina to further continue.
All right, thank you, Hortensia. It's a lot of numbers, folks. I mean, she did an excellent job in coming in the evaluator role and really taking on a lot of duties and trying to capture that data. Because think about it. Think about all the sources and all the things that we could be collecting. So it's really good that we had her on board and she was able to process that data. Okay, so moving on to the regional needs assessment. So what we're going to present on are the key 2015. The actual full report of the needs assessment will be available on July 30th, so in a couple of weeks. So this report is about a little over 100 pages. So it's thick, it's very thorough, and it's very informative. So after the 30th or on the 30th, we'll have that available on our website. However, on the USBs, you do have all the documents in electronic form that are in the folders, and we will have our presentation available to be able to be uploaded onto USB if you. Okay, so the data is mostly regional, but we do have county-specific data. So if you are looking for that county-specific, don't fret. We have our data repository, and again, through the data request, you can ask for that county-specific data. So let's talk about the demographics of our population. So the regional population in 2014 was a little over 2.7 million. So the population density is 87 persons per square mile, and Region 8 is over 31,000 square miles. So again, for those of you who are working in counties, you know how to put some miles on your car going through different communities. Okay, so the population ranking. So how do we rank compared to state and in the nation? So these are how our Region 8 communities rank by population. There are 254 counties, and in Region 8, Bexar County is the largest county that we have, and Edwards is the smallest, ranking at 236 in the 254 total counties. So Region 8 ranks 4th in population when compared to the state, and Texas ranks 2nd in the nation in population compared to the nation. All right, so the median household income from Region 8 was about $45,000, which is $6,200 lower than the median household income for the state, which is $51,000. In April of 2015, unemployment was at 4.1%, which is down from 4.6% from last year. And the weekly wage in Region 8 was $750, which is lower than the Texas average of $988. In regards to language, about 61% of Region 8 citizens 5 and older speak English at home as their first language. There's more than 36% that speak Spanish as their first language. So it's imperative that we do have programs and services available in Spanish. Criminal activity. So in Region 8, the total offenses by males under 18 years old accounted for almost 70% of the crimes committed in 2013. Drug abuse violations were the highest category with 20% of the total offenses in Region 8. Drug possessions account for 18% of arrests during this time frame. And all illicit drug-related offenses, drug abuse violations, drug sale, manufacturing, drug possession, account for 40% of the arrests in Region 8. Dropout rates. So annual dropout rates by grade span, 2012 to 2013, for the state of Texas was an average of 1.6%, which is lower than the Region 8 of 2.1%. According to the data collected from the Texas Education Agency, Region 8 accounts for an alarming 44%, if not more, of 7th or 8th grade dropouts for the state in 2012 to 2013 school year. Of the amount of students who dropped out between 7th and 8th grade in the state of Texas, Region 8 accounted for almost half. Teen pregnancy. So So Texas has the fifth highest birth rate among teenagers, behind Arkansas, Mississippi, Oklahoma, and New Mexico. And Texas, where schools are not required to teach sex education, has the highest rate of repeat births among teenagers ages 15 to 19. The Center for Disease Control and Prevention has examined a troubled subgroup of teens who give birth to a second, third, or even fourth child. These are repeat teens' births. Of all 50 states, Texas ranks number 1 in this phenomenon. Teenage birth cost Texas taxpayers $1.1 billion in health care, foster care revenue in 2010, according to the National Campaign for Prevent Teen and Unplanned Pregnancy. The teen birth rates, which are females 15 to 19 years old, was at 3.1% in Region 8, which is lower than the Texas rate of 3.8, but higher than the national rate of 2.4. Birth mothers ages 15 to 19 resulted in 4,668 births in the region. Suicides. So self-harm by firearm had the highest method, followed by self-harm by hanging. Data was collected from the Center for Disease Control and Prevention, National Vital Statistics Systems, and Texas Department of State Health Services. Counties with 9 or less total numbers of suicides were suppressed. The regional annual summative total from 1999 to 2013 was 3,912 suicides, giving Region 8 a higher mortality rate than the state of Texas. I apologize for this slide, it's a little small, but this chart depicts past year depression treatment among adolescents 12 through 17, with major depressive episodes in Texas from the span of 2003 to 2013. The gold represents the 35% of adolescents who received treatment for depression, and the maroon represents the 64% who did not receive any treatment at all. And I want to interject that the mental health information was really hard for us to find. We went on a lot of state and national data. So as we moved into the 2016 information, and because substance abuse and mental health are so correlated, this is one of our priorities in gathering more mental health information. So this chart tells us that over almost 400,000 individuals in Region 8 receive Medicare with Part A and B. And of those, 38,000 have depression, which represent about 13% of those who have Medicare beneficiaries who are depressed. And this had so much information, but I wanted to put it all. But basically, this is talking about the type and quality of drugs seized in 2013. And this information came from the Texas Department of Public Safety in 2013. So the cannabinoids, which is marijuana, hashish, there was over 15,000 pounds that was collected in Region 8. Behind that was the second highest that was confiscated here in Region 8 was the methamphetamines at 148 pounds. So again, if you want to download the presentation, we can provide that for you, and you can have this information. But again, this came from the Texas Department of Public Safety. So this chart is from the U.S. Customs and Border Protection. It represents the number of apprehensions and drug seized through the border. As a local office of the United States Border Patrol, the Del Rio sector is responsible for detecting and preventing the smuggling and unlawful entry of undocumented immigrants into the United States along 210 miles of the Rio Grande River and Lake Amistad that forms the border between the U.S. and Mexico. So this area of responsibility covers 59,000 square miles of Texas and reaches 300 miles of Texas from the U.S.-Mexican border. The 41 counties in the sector consist primarily of farms and ranches. So my question was about why Del Rio is the only city listed on here, but it turns out that it's a Del Rio sector, and that the Del Rio sector accounts for Abilene, Bracketville, Carrizo Springs, Comstock, Del Rio, Eagle Pass, Rock Springs, San Angelo, and Uvalde. So all those checkpoints report their information to the Del Rio sector. So what they reported in 2014 is that they confiscated over 21,000 pounds of marijuana and 24 pounds of cocaine. And we were talking about this earlier about how there's data numbers and then there's federal information and how the two can overlap. So again, that was a gap on trying to report accurate data because different agencies report to different databases. It's pretty eye-opening to me. All right, in regards to substance abuse treatment and adolescents, which is 12 through 18 years old. In Region 8, there were 351 treatment admissions, which represented 7% of the state's total. Age admissions into treatment of Region 8 for 2014 was 38% were 16-year-olds, 21% were 15-year-olds, 18% 17-year-olds, 14% were 14-year-olds, 7% were 13-year-olds, and 1% were 12 years old. What really stood out to us was that 89% of treatment admissions were for marijuana and hashish, 3% methamphetamines, and alcohol and other cannabinoids each accounted for 2% of the treatment admission. So if the argument is that marijuana is not addictive, then the numbers of adolescents admitted to treatment is telling us otherwise. So that concludes my portion, and now Teresa Stewart will talk about the data findings from the Texas Schools Survey. Thank you.
Good morning and welcome. Again, I'm Teresa Stewart, one of the community liaisons for the Prevention Resource Center. The purpose of the Regional Needs Assessment is to improve and enhance the current substance abuse programs across the state of Texas. So the Texas School Survey plays a very important role in the RNA as it addresses many topics about our youth as it pertains to alcohol, marijuana, tobacco, and other drugs. The Texas Department of State Health Services contracts with Texas A&M's University's Public Policy Research Institute, PPRI, to survey schools, colleges, and universities regarding students' self-reporting of alcohol, drugs, prescription drugs, and tobacco use. So you're going to see a difference in what Gina just reported to you compared to what the kids are saying they're really doing. So you're going to see a little bit of a difference there. Over 2 million students have been surveyed across Texas since it began in 1988. The 2014 Texas School Survey is unique this year. For the first time, the state was divided into 11 geographical areas, with Region 8 being our area covering 28 counties in south central Texas. The survey findings continue to provide state policymakers information for planning and prioritizing drug education programs and other initiatives throughout the state. The Texas School Survey is the most comprehensive report in Texas for surveying our youth. The types of reports published include state, regional, border, non-border, and district level. The types of substances reported on are many and include illicit, prescription, and over-the-counter drugs. The report measures frequency of use, age of initiation, peer use, driving under the influence, access, perceived danger, parental approval, and related behaviors. The complete report is 114 pages of raw numbers. The first part will focus on a particular substance. The second part focuses on a subpopulation. And finally, the third part focuses on tables and charts. The Texas School Survey is conducted in two parts, the state and local. The state is conducted during even years between the date of December 1st through the end of the school year. The local is administered as well as colleges and universities during the odd years, during the same time period of December through the end of the school year. The school survey is designed to be responsive to questions of specific interest to Texas educators, policymakers, parents, and community groups. School participation for the Texas School Survey has been declining over the past few years. So Texas A&M University's Public Policy Research Institute conducted focus groups in 5 areas across Texas to determine what the barriers were for school participation. Their findings were, schools were not required to collect this information. In the past, many school districts received grant monies from the Safe and Drug-Free Schools, which had a requirement for schools to collect substance use data. So during these times, schools participated. Now that there are no more Safe and Drug-Free School grant monies, schools no longer participate. In addition, there is conflict with district and state testing windows that prevent participation. As a result of the declining participation, our region was combined with Region 7. Here you see a map of Region 7 and 8, which depict the counties that had school participation historically since 2010 to present. Notice the pink triangles. These are the counties in which schools participated most recently in the 2014 survey. Bexar County, our most populated area, had 0 schools to participate. All but one of the schools were to the east of our region. Would you call that a gap? Very big gap. This slide gives a comparison of the nation, state, and region. The regional and state data came from the Texas School Survey for 2014, and the national data came from the CDC's Morbidity and Mortality Weekly Report dated June 2014. Alcohol continues to be the most abused substance. And do you remember the poll? What was the #1 substance? Alcohol, so they're the same. It's followed by tobacco and marijuana, kind of. You're going to see something here amazing. As previously stated, what is the most abused substance? Alcohol. It continues to be the most commonly used substance. However, for the first time ever, marijuana surpassed tobacco across the state of Texas. Marijuana surpassed tobacco. Tobacco leads by a very small margin of 0.4%. For the state, alcohol use also ranks #1, followed by marijuana, then tobacco. Marijuana leads tobacco by 0.8%, the largest gap between the 3 geographical areas. For our region, alcohol use ranks #1, followed by tobacco, then marijuana. Tobacco leads by a very small margin of 0.2%. Now remember, the stuff I'm reporting on is what the kids say they're doing. This is what the kids say they're doing. We just hadn't caught them yet. When comparing the state and regional data of substances ever used, our region ranks below the state in all areas except meth and steroids. And we heard the number of meth, it was very high. It was like the second highest confiscated. In 2014, almost half of the students surveyed in Region 7 and 8 reported having used alcohol at some point in their lives. In the past 30 days, 11% of students in 7 and 8 had at least one binge drinking episode of drinking 5 or more drinks at one setting. "44% of students report alcohol as somewhat easy to very easy to get, compared to tobacco at 32% and marijuana at 30%. When we compare the access to reported use, we can see a pattern. If it's easy access, students will use. On perception of harm, 74% reported that marijuana is somewhat to very dangerous. And whenever there's a perception that something is harmful to you, you're less likely to use. So this depicts that when we compare it to the tobacco, and which is higher in Texas right now? Which drug is higher right now across Texas? Marijuana. You can see they don't think it's dangerous. And so then you can look and see the number on the bottom, they're using it more compared to tobacco. Okay, so now I know my slides are out of whack. When it comes to comparing males and females, females surpassed boys in alcohol usage for the past 30 days, for the entire school year, and as reporting as having ever used. So the girls have caught up and surpassed the boys. Students not living with two parents reported using marijuana more than twice as much as those living in a two-parent household. And this was true for most of the drugs across the board. The state and region were very similar in reporting their use of prescription drugs and over-the-counter drugs not prescribed for them. Students reported cocaine, cough syrup, lean nods, ACDC as the most used, followed by Vicodin, Lortab, Lorcet, and hydrocodone, and finally, Xanax. Over-the-counter DXM, Triple C's, and Skittles were reported as used more than Vicodin and Xanax. The top 3 inhalants students reported as used for Texas and our region were also very similar. Whiteout, correction fluid, magic markers were most reported as used, followed by helium, butane, propane, whippets, nitrous oxide, refrigerants, freon gas, and finally, spray paint to get high. Do any of those surprise you in the order? I personally thought it would be paint. In general, all substance use increases by grade level. However, for our 6th and 7th grade students, we see the opposite effect. More 6th and 7th grade students reported that they were more likely to use inhalants. So I want to stop for a minute. Now we have some data, and I'm going to pretend for a moment that I'm the superintendent. This is the results from our survey. As a superintendent, I'm going to look very seriously at this, and I'm probably going to start thinking about prevention for the younger students on my campus. I may even go so far to even back up a couple of grades prior to. So the Texas School Survey is very important to use. I might even consider addressing the PTA, the PTO. I might be trying to come up with alternative activities for the kids to do after school. So the Texas School Survey is very important. "15-year-old students reported usage the most in both the state and region. The largest gap between the state and region surveys noted were that 11-year-olds, listen to this, 11-year-olds were 7 times more likely to report usage. 12-year-olds were twice as likely to report usage in our region. Now I'm looking at it and I'm thinking for sure as a superintendent, I'm going to put prevention education on my campus. The students in our region were surveyed that if you had a drug or alcohol problem and needed help, who would you go to? Over half of the students surveyed reported that they would not seek help. Over half of the students would not seek help. The 48% of those that reported that they would seek help would not seek help from school, but rather from a parent, friend, another adult, or medical doctor. So once again, I'm the superintendent. Am I going to push my money into counseling at school? Probably not. I'm going to look at the other avenues. A huge gap exists in prevention education across the region. 73% of students surveyed reported that they received no prevention education at all. Prevention education does work. As reported by the Texas School Survey from its beginning in 1988 through 2014, there has been a gradual decline in substance usage. The Public Policy Research Institute concluded, we still need to continue with need assessments in our communities. This concludes my portion, and I will be followed by Betsy.
I'm Betsy Jones. I'm the Tobacco Prevention Specialist here in the PRC. Okay. In 1992, the rate of tobacco sales to minors in the United States was 40%. That means that of all the kids who tried to buy cigarettes in 1992, 40% of them were able to do it. So the Sinar Amendment, which was enacted in 1992, was enacted to reduce youth access and marketing to youth of tobacco products. The amendment requires the states to enact and enforce laws that prohibit sales and distribution of tobacco to minors, and also requires states to conduct random checks of tobacco retailers to ensure that they're not selling to minors. As of 2013, the national rate of sales to minors had dropped and leveled off at about 9.6%. The states report their progress to the U.S. Department of Health and Human Services, and states that do not hold their rate of sales to minors or their retailer violation rate below 20% will lose some of their money that the states received in the block grants that were funded by the tobacco industry settlements back in the late 90s. The block grants are made up of money from the settlements, and the 11 PRCs conduct regional compliance checks and follow-up visits. So all 11 of the Texas Prevention Resource Centers have a tobacco specialist, and we basically go out to convenience stores and 7-Elevens and grocery stores all over the state and make sure that the marketing and sales to minors are kept down. The Prevention Resource Center in Region 8 is responsible for 1,800 compliance checks in the region, 100 follow-up visits, and at least 20 follow-up visits to non-compliant retailers. Texas settled with the tobacco industry in 1998. We were the third state to settle. And over 25 years following 1992, we received $17.3 billion from the block grants as compensation for the health costs that the state incurred as a result of tobacco. The Texas legislature used $1.5 billion of those settlement monies as endowments for the Health and Human Services and Higher Education departments. So I've got a chart here that shows some of the money that came to Region 8 from those endowments. This is the money that was given to hospitals and healthcare facilities to offset the costs of their tobacco-related healthcare expenditures. So all of these unreimbursed healthcare expenditures were offset by some money. Obviously, Bexar County, with a large number of hospitals, received several million, but the other counties that have hospital facilities also received some money from those settlements. The endowments also generate $9 million per year in interest for education and enforcement programs. That's where the tobacco prevention specialist comes from and all of the tobacco prevention programs that we have in the schools. For tobacco law violations, we have sales to minors. Obviously, we don't sell cigarettes or try not to sell cigarettes to minors under 18. We want approved state signage in all of the retail outlets. The state signage looks like this. And if you go to a convenience store, look up around the tobacco displays and you should see these blue signs somewhere. You don't always, but hopefully you see the blue sign somewhere. Tobacco companies provide a lot of their own signs that we put next to, or that the sellers will put next to the tobacco displays. They range from ineffective. The We Check ID sign is the smallest and least effective, all the way to some signs that are basically just reminders to kids that the cigarettes are here. You're not supposed to buy them. We're not supposed to sell them to you, but the cigarettes are right here. So these are the state-approved signs that we put up. We also prevent outdoor advertising within 1,000 feet of a school or a church. The stores have to have a posted permit that's not expired, a valid permit to sell tobacco, and they're not allowed to sell unpackaged cigarettes or loosies. They're not allowed to sell packages of fewer than 20 cigarettes. And obviously, minor in possession is a crime. Minors are not allowed to possess it, purchase it, consume it, receive it, accept it, or represent their ages falsely in order to get tobacco products. And we also have a few other criminal activities: tobacco smuggling, counterfeit permits, tax fraud, the other tobacco-related violations. So, as the Prevention Resource Center Region 8 tobacco specialist, I do 150 voluntary tobacco checks per month. I look for these signs to be posted near the cigarette display. And what I tell the retailers is, when I'm looking at the cigarette display, this needs to be in my line of sight. I look at the displays themselves to be sure that they're either locked or out of reach. So the cigarette displays have to be locked, or they have to be behind the counter so that customers can't reach them. The tobacco products have to be handed to the customer by an employee. The other thing I check for is a valid original posted permit with the correct address, the correct business name, and an expiration date. I advise the managers or employees that this is a voluntary check. I don't deliver citations. I don't punish anybody, but I do voluntary checks to ensure that they're in compliance. And later on, when the state auditors and the federal auditors come through, they are the ones who actually cite and punish the sellers who are not in compliance with the laws. I hand out these packets of information. These are my packets. I've got all kinds of educational materials for tobacco retailers on the tax laws and the tobacco laws, and also some fresh signs. A lot of times the reason why the signs disappear is because they look ugly, they start to get torn, and the retailers don't like to have them posted, or just because there's a lot of employee turnover in that type of business and they don't realize that those signs are required by law. All right. So, in fiscal year 2015, the Region 8 PRC has conducted so far 1,416 retailer compliance checks, and 384 are still remaining to be finished by August. In that time, we found over 1,200 valid permits. That's about an 85% compliance rate. We got some copies, 15 copies, 54 expired permits, 41 that were valid but not displayed. They just kind of had them behind the counter. And 96 who just couldn't find the thing at all. That was usually an employee who wasn't aware that it was missing. So most of what we find is that retailers want to comply with us. They're not doing, they're maliciously losing their permits. They're not refusing to show us their permits. They just don't always know the rules, which is why we go at least once a year to everyone we can find and give them more signs and more packets. Oops. Okay. So, we've conducted 106 follow-up visits and 23 visits to non-compliant retailers. As far as the signage, about 30% are not in compliance with the signs, often because the signs are damaged or get thrown away. So we pass out more of those blue signs every chance we get. And if you look on our website or go to the Department of State Health Services website, you'll find the tobacco hotline. So if you happen to be in a convenience store and you want to report missing signage, or you see a tobacco retailer selling to minors, or you know of one selling to minors or selling loose cigarettes, there's a tobacco hotline. It's anonymous. You can call or email the state comptroller and report those violations.
I'm going to use the microphone.
Okay, thank you, Betsy. So at this time, I want you all to kind of stretch, and as you stretch, if you can please pass the sign-in sheets and your turning point clickers to the right. Our interns will come along and pick those up. There's a saying that data can be draining, so we want to make sure that we get the blood flowing. Okay, so as those clickers and sign-in sheets are being passed out, are being picked up, I want to talk about the data request form that's in your folder. So I have repeated this a number of times about that we have a data request form. Again, we are a central data repository. And this is the form that you would use to request county-specific data, to request the regional needs assessment, to request any information from our repository. So this form will be available online. And we encourage you again, if you want any kind of data, to use this type of form. Okay. So we want you to partner with us. So we have a community agreement in each of your folders. So we do have a good number of community partners with us now, but we are inviting you to partner with us. So what does it mean to be a community partner? Well, we provide, PRCs provide data that they contribute to the data repository. So perhaps you have a data source that you think might be able to benefit the repository, or maybe there's a community that you want to bring data to. By becoming a community partner, you have access to this data as well as regional needs assessment. We also come out and do presentations about data. We do presentations and what the concerns are and how those signs and symptoms can cause those types of percentages and such. But we do those types of things. And I want you to take a look at that community agreement and partner with us today. It's a legally binding agreement, and it's a partnership on paper. So think of it like a handshake. That handshake is showing that we are partners. And if you fill one of those out today, if you can please leave it on the table before you leave today.
Does it have to be agencies or can it be individuals?
It can be either or. Either agencies or individuals. Good question. Thank you. Also, so as we're moving into our second year of our needs assessment, we are going to be recruiting focus groups. So these focus groups will be both with professionals and in the community, and we will be measuring, one, how well the RNA was used, if you like the RNA, if it was useful, what things could be added to it. These are some of the questions that we want to be asking the community. Because again, we didn't develop this tool for ourselves, we developed it for the community. And if the community can't use it, or professionals don't understand it, or need something else, we need to know that so we know what improvements to make. So we will be looking for focus groups in the fall, this coming fall. So after the meeting today, we will be sending out an email about these focus groups, and you can send your information through that way. Okay, so we are at the question and answer part of the presentation, and are there any note cards out there? Okay, we have one. Alexis is picking up the note card, so if you have a question that you'd like to ask, you can please hand that to her. If you have a question, you can please raise it, or if you have one that you haven't turned in.
Any other last?
All right, so, can you hear me?
so our first question is, what are you doing about the workers going out into the community, and what about their safety? So that is our first question.
So for us, that's a good question, but for us, we're not necessarily going out into the community as an agency that is doing the local and regional needs assessment. It's mainly collecting the data and the information and then sharing it with the people that do go out to the community, that do go to the homes and do the services, direct services. So for us as an organization, we don't really do that. That's always a concern, and what we try to do is connect people to people that provide trainings. We have the Prevention Resource Center also does a list of local trainings for prevention, recovery, and treatment support services. So sometimes there are those types of trainings that are scheduled, safety, making safe calls when you do home visits and things like that. I hope that answered that question.
Okay, so the next question that I have from the audience is, should we talk to our school districts about the Texas School Survey?
Yes, that's what you do. We've been sending letters. All the school districts within our Region 8 geographical area, we've been sending letters. We've been addressing PTA, the counselors, any way that we can get it out there, we've been trying. And currently, the Texas A&M PPRI is also hitting the school district with letters, and they're also going to pay them a stipend this year. So, and then I also understand that our coalition may have some money put aside for Bexar County to help pay for it if they're not selected, but I'm sure they would be selected if they apply. They didn't say. I don't know how much the stipend is going to be. They didn't say.
Can I just make some feedback comment? Is that probably the best way to get that implemented in school is through their school health advisory council or their SHAC. And so possibly even trying to become a member of local SHACs would be an awesome way to move this initiative forward.
And we're doing that. Thank you. And it's hard, that's even hard to find a complete list. It's very time consuming, but yes, we're working on that. Thank you. And we've been working on Region 20 too, and I'm glad you're here.
Alrighty, so the next question that I have from the audience states, in working with district liaisons, we've been informed that we cannot partner with Cicada or bring in Cicada/other prevention resources due to the use of surveys that may reveal incriminating information about our students. What steps are being taken to open communication with districts about allowing students to receive the needed prevention programs?
Big barrier, and not just for our organization, Cicada, but for other organizations that want to go in and do prevention work. As Hortensia was saying, all of the data that, whether it's a survey that the kids do, that the parents, the school counselors, this is all confidential information, and it's taken, aggregated, and shared as a whole. So that information is never, given out. Like this one kid, Robert, said this in his response to that question. We provide that information as a whole, just like they do the Texas School Survey. And yes, that is a big barrier, but I believe that parents that go to school board meetings and talk to their school board and say, hey, no one in Bexar County did the Texas School Survey. We don't know what our kids are doing or using since 2012? The last time that someone in Bexar County took the Texas School Survey? Yes. So parents, who here is a parent? Who here is a grandparent? An uncle or an aunt? So that's all of us. We need to go to those board meetings, school board meetings, and create a little bit of ruckus and say prevention is important. And we can't bring prevention unless we can tell the numbers about what's happening in our school. But sometimes, school districts are scared to show, oh, our kids are using at age, 11 or 12 years old. But prevention is key. And so if we We cannot allow our school districts to stick their head in the sand and do nothing. So let's go visit our school boards. If you want someone to go with you, we have a whole team that show up. So, but yeah, those are things that we do have to address, and it is a barrier.
And may I also say that the TEA website, schools are already reporting their discipline actions through there. So if you wanted to find out whether or not you want your child to go to that school, you go to their website and do your own research. So that's already out for the public to use.
And I would also add, if as an argument with some of the barriers, is that some of the school districts do have prevention programs and curriculum, but they're not testing it. They're not looking to see, assessing where their students are. Then how are they going to be showing that their prevention program or curriculum is effective? And so that could be an argument. You know, say we already do prevention, but you're not indicating whether you're effective or not. So this will help you do that.
Great point.
And there is also steps documenting how to keep the data confidential. And like I did mention earlier, there is an act of privacy when it comes to statistical information.
The next question is, how is the data being collected and by whom for the children?
Data.
Well, the second question is related to, so I'll just ask it. How do you account for the validity of the responses with a population of children?
Like we mentioned earlier, we are primarily collecting secondary data, which is data that's already been processed. The primary data that we're going to be collecting next year is more focus groups. In those focus groups, we're going to try to keep the confidentiality, and we won't be asking for personal information, so it'll be firsthand receiving that information. Right now, the secondary data sources that we're collecting, it's by valid and reliable sources like the U.S. departments, the U.S. Census, and other already identified as reliable and valid information. I hope that answers the question.
Okay, so the very next question for the panel, and I think this would be directed towards you as well. Since San Antonio is a military country, do you have any data that includes the military children or families?
Yes, that is one of the special focuses that we did address in the RNA because San Antonio is considered to be military USA. We have several of the bases and some of their information in this RNA as well. Because there is a high rate and prevalence and incidents being reported with military veterans associated with substance abuse and mental health, we felt that it was an issue that needed to be addressed in this year's RNA as well.
So you're saying that you get some of the data directly from the different military bases? I know they collect that data.
Yes, but because it is the Department of Defense, some of that data was not available to us. So we had to go through other reliable sources to get that information.
Last question. Should more of the sign-on money be earmarked for tobacco prevention?
That was mine.
Yes.
That's an easy one. Is this on? Yes, and one of the problems that we are starting to see now, the 2013 numbers that I mentioned earlier, the 9.6% of students being allowed to purchase cigarettes, that's actually gone up a little bit since 2012. It's 0.4% higher than it was in 2012. And the way it looks is that, starting with 40% of minors being allowed to purchase in 1992, we've eliminated the low-hanging fruit. We've had prevention classes in combination with reducing sales to minors, and now we're at the hardest 10%. But some school officials or prevention providers seeing that, well, not the providers, we know better, But we see that and say, oh, it's, we've gone from 40% down to 9.6%, that's great. So let's take some of the money and put it someplace else. When those prevention programs are actually what's causing us to get down to 9.6%. So yes, absolutely, as much as we can do to work on the remaining 9%, and every year we have, new youth, new smokers, and the tobacco company would like us to make more smokers. So we need to continue to do tobacco prevention, even though we're doing better.
So, kind of a related question. What about, you guys are going to these convenience stores and so on, but what about these vape stores and hookah bars and e-cigarette centers?
Yes, ma'am. Asking about the vaping stores and hookah bars. The vaping liquids up until last month were completely legal in Texas for youth to buy. So up until now, there hasn't been a whole lot we can do other than keep an eye on it. As of now, the governor just signed into law last month that those products will be included under tobacco laws. So I'll be able to check that, and I'm assuming that those stores and shops will be on my list for next year. Yeah, it's very late. I am busy, yes. But we're doing the best we can, and a lot of education. There's a lot more kids interested in e-cigarettes and hookahs because they look cool. And that's the point. They made them look cool because kids like it. So we're doing the best we can with education and just chasing down as many retailers as we can.
So I imagine y'all are probably going to end up adding e-cigarettes to your data, because I know that that's more and more places are gathering that data.
We already have that data as well, and we do have a section that's going to be discussing the e-cigarettes and the vaping and how it has affected our youth in the RNA as well.
And the Texas School Survey, in their 2016 survey, they will include e-cigarettes and vaping.
What age do you use, and I apologize, you said this in the presentation, what age children take this school assessment?
They begin in grade 6, but this coming cycle, they're going to just collect from 7th grade and up. I think somebody had a question, and you were worried about the validation of a young kid reporting. On the Texas School Survey side, they have trick questions in there, so if they answer one of the questions funny for a fake drug that isn't out there, they'll totally eliminate that person's information. Yes, sir?
Why did they take out 6th graders? I thought you wanted to add 5th graders in TSS.
I don't know, but we can ask the PPRI.
Because it's really clear that it's starting at a younger age. Like, that trend has continued since I've been aware of it, So wouldn't you want to include maybe 4th graders into it too?
Even in kindergarten. Because they do know.
That's part of the Texas School Survey, but one thing that we're going to be looking into next year is also the YP program, since they do address some of those questions, and it is for other ages. We'll be also looking into that data as well, to have another source.
But I will pass it on to the PPRI.
And when she says YP data, she means youth prevention data. So we have prevention providers in our area who are funded by the Department of State Health Services, so we want to be able to capture what they're reporting. Because they're going out and they're doing curriculum and they're reporting to the state, but we want to see how we can fit that into our RNA, because we want to see how the needle has moved with these curriculums.
So just to that one, and then another question. Back when I was a school nurse, Weekly Readers used to do an elementary survey for, I guess, alcohol and drug use. And so, it may be, probably not doing it anymore these days, but it may be that there's a mechanism that the Weekly Reader type stuff are doing it, and they send data somewhere that you might.
The thing with data, what I noticed, I did a very extensive literature review and a mega-analysis on previous literature.
Yeah.
Some of the data that was conducted years and years ago, and I mean very good data, is no longer being done. It's either by funding or for whatever reason, that data is not current. So I was unable to use this data that is, we need that data. And that's the whole point of doing the RNA and for them to be going out into the community, is to get this data from our local and our communities.
And my last question. So the marijuana and tobacco use was more or less similar, it was between 0.2 and 0.8 difference. Do we have any data yet on the states where it's been legalized and how that's changing use with youth and even, I guess, adults too, because if it's happening with adults, it's going to follow through with youth. But we have any data yet on them so that we can see whether that would make a difference if, if it ever becomes legalized in Texas?
They're just starting to. In Colorado, they didn't have a lot of plans in place. There weren't a lot of plans in place when they legalized marijuana, so they didn't have the regulation or the survey information available. But they are starting to examine that in our findings. I don't have the statistics on hand, but they're finding that in states where medical marijuana is legal, a higher percentage of youth are using marijuana. So the states where it's recreationally legal, it's even higher. And especially with the edibles, the gummies, and the cookies and candies that are attractive to kids, they're having a lot more issues of youth overdose. So I think we're going to put some hard numbers on that in the assessment.
But they do have an age limit in those states of 18 to be able to buy the marijuana.
They do. They're not allowed to buy it legally, but they're not allowed to buy tobacco legally either.
The thing is, and there is a section in the RNA where misconception is being addressed because kids nowadays think that marijuana is legal, which is not. It's playing also a big factor into the usage of marijuana.
It goes back to the perceived damage or harm, and so, gosh, it's legal, so it must be okay. Okay, so,
I know marijuana is widely known as the gateway drug. So I was wondering, like, tobacco, I always thought was more of a gateway drug because it already instills that psychological, like, the smoking addiction, even if you're not physically addicted to it. And so I was wondering, is there any data on, like, did you have your first cigarette? Did you have a cigarette first or like a joint first or whatever? Because that could show if tobacco really is what's influencing marijuana or maybe it's even vice versa.
One thing that we do address is that all substance use for a minor is illegal regardless.
Right.
So all of them would be considered gateway drugs, even if they use tobacco or marijuana. It's still illegal for a So, I mean, that's one point that we stress out, that regardless of what it is, it's illegal for you to have.
Yeah, I guess I was just more concerned about, like,
In
the
specifics,
behavior as far as, like, most start smoking cigarettes first, and then they're like, well, I've already smoked this, you know what I mean?
some of that data will be available, and I would have to get back with you on that specific answer. So if you can send me an email or get our director, we'll be able to address that.
Okay.
Join our focus group.
Yes. Yeah.
We'll make it.
Yeah, definitely.
Thank you. Thank you all for writing down your questions. We are going to get to these, so we're going to post these on our website, everybody who have written these down so that you get your answers. So don't worry, we're going to get to them, but we have to move forward with our closing message, and Ms. Abigail Moore will bring that to us.
Okay, so you just got tiny little snippets of the data. So remember, the report is 100 and how many pages? And there's more data in our repository that we can share with you. So it's endless what you can get, not endless, but we've got more. And we need you to help us get more. Call to action. Call to action. So, we all know either our children are in school, our grandchildren are in school, our nephews and nieces are in school. We need to visit those school boards. If you need talking points, let our team know. We can get you a one-sheet information about the importance of participating in the Texas School Survey to be able to see, is your school being effective? Because then you have a baseline and you can see the next year, our numbers went down, our prevention's working, or let's invite more community partners because the school district may not have the dollars, but bring in the partners that are experts in that field, in those areas to do the prevention work. And then again, they do the Texas School Survey and they see a baseline change. They see a change. What are the trends improving? Are they still needing to be addressed? So again, first part of call to action, let's talk to our schools, let's talk to our school boards, and let's take that message in. Bexar County, 0? That's unacceptable. So I believe that us together, remember, begin with the end in mind. We want to be able to tell the picture of where we want our community to be. But we need to get the information now to change that and to set a new pace for it. So we can partner together. You're not doing it as alone, but you are the influencer in your circle of influence. It can't be Teresa. It can't be Beth. It can't be Hortensia. It can't. We are the influencers of our circle of influence. So let us give you some of the information. Let us give you the tools. Let us go with you. We want to talk to your neighbor that's on the school board. Those things make a change. And I want to be able to say, we want to be able to say next year when we're sitting here doing this again, that at least 2 or 3 schools in Bexar County took the school survey, then we, as a group, move the needle. Call to action number 1. Call to action number 2. Share the data. So once you get the report, it's on you can go home, take a look at it, put a pot of coffee on, have some donuts, take a look at this in your jammies when you're doing nothing on Saturday. So this is the data. You have it. As far as the regional needs assessment. So then you're going to ask the question, well, this is missing. Or I would like to know this. Well, if you have the data, we need you to share it. Or if you know where to get it. Again, you've got that sheet on there that says the data request form. Fill it out and send it to us. Number 3, call to action. Now that you have the data, you got to tell the story in your community. How can we help you tell the story? We did something really simple at the beginning. Remember when we had about 7% of the people sitting down and the other 93% had to stand up? And we said, these individuals in the schools did not get prevention. That's a simple way to tell the story. I think it's pretty powerful. We need to take it to the people that are our circle of influence, okay? So then, sharing the data, getting the data, telling the story. Let's help. We can do this together. We've got to move our school districts to start taking this information. And yes, in the past there have been surveys done, but if they didn't continue to get done, then that baseline data exists and there's nothing else that measures that same thing. So the Texas School Survey, it's something that A&M University does for the state of Texas, and they're trained, empirical, making sure that the test subjects and that there's no abuse of how we're asking the questions. Again, it's the professionals that do that. So our kids are not in danger, but this information is important for us to be able to tell the story. And then, if you have other stakeholders, call action, final. If you have other within your circle of influence, whether it's your county or whether it's another place that we can go and give snippets of the data, and you want us to go along with you, we would be more than happy to as the Prevention Resource Center. So again, this was our first year. We thank you for showing up because again, as the highly effective community that we want to be, 7 habits, being proactive, doing something and not just sitting around and let somebody else do it, we showed up. We are proactive here. So now we're going to come together and synergy to change our community, that our community is safer. We believe that it works because if you look at some of the numbers, like Betsy and Teresa were saying, those numbers are beginning to go down. as far as the tobacco, but we're getting new smokers. New communities, because we are Military City, USA, new families coming in, new children beginning to be exposed and experiment. So we can't stop. The efforts cannot stop. We have to continue them. And one last thing. All of this is interconnected. I asked individuals in the beginning, who does teen prevention work? Who does suicide? Who works in the criminal justice? All of those areas are interconnected to substance use. Mental health, young people struggling with depression, ADHD, they self-medicate. Adults, criminal justice area, we've interviewed them, there's research that shows that they began smoking at age 10, the tobacco, and then they moved on to the other things, and so now they're in the system. We ask individuals in treatment facilities. There's questionnaires that have asked individuals in treatment facilities, when was your age of first use? And you hear 9, 10, 11 years old. So prevention is key. We can do this together, and the data helps you regardless of whether you're working with senior citizens, because there are senior citizens raising grandchildren, so they need this information as well. We need it in our schools, we need it in our churches, in our communities. It helps us all. So the data repository has information not only in regards to what's in the needs assessment in your little jump drive, but we have others. And if you need it, we are here for you. That's bottom line. The Prevention Resource Center is here to provide that information. And we're also going to need partners. I am committee one right here to our epidemiology work group, coming together 3 times a year and looking at what were the gaps and how can we identify partners to help us fill those gaps. So thank you very much. I don't know if I heard thunder or tummy rolling because it's lunchtime and we're all hungry. Is there an evaluation piece, anything else that they need to feel? Thank you and have a blessed day.
Ladies and gentlemen, thank you for attending today. I'm going to have the interns come and collect your evaluation. You have to stand by the door. Your certificates are out in the hallway at the entrance of in the lobby. Thank you again for coming, and hope you have a wonderful day. Thank you.